Okay, picture this. You're at the bedside, your patient is getting harder to wake up, the monitor is beeping like crazy. And then the lab results flash on the screen, pH 7.20, PaCO2 is 60. You feel that knot in your stomach.
What is your next move? I know, your heart just skipped a beat. But here's the thing, don't panic, because by the end of this, you are going to know exactly what to do.
All right, let's do this. Welcome, everyone. We are about to make arterial blood gas analysis so simple, you'll wonder why you ever stressed about it. This is your master guide to walking into the Nclex feeling like an absolute pro.
So here's our game plan. We're going to start in the body's control room. Then I'll give you a secret weapon called Rome. After that, we'll master a simple 3-step solver, meet the 4 main acid-base villains, and then jump into the practice arena to test your skills before we cover some can't-miss bedside procedures. Let's get started.
First stop, the ABG control room. So what even is an ABG? And why do we as nurses care so much about these numbers?
Think of it like this. An ABG is basically a report card for 2 of the hardest working teams in the body, the lungs and the kidneys. It tells us exactly how well they're doing their job of keeping our body's pH in that perfect, delicate balance needed for, life.
And this is your command center dashboard. You absolutely have to memorize these numbers. No way around it. The pH is the main goal, between 7.35 and 7.45. PaCO2 is the acid controlled by the lungs. And HCO3, or bicarb, that's your base, and it's managed by the kidneys. It's a constant tug of war between these two to keep that pH right where it needs to be.
Now for the fun part. I'm about to give you the ultimate cheat code. This one little trick is going to solve half of every ABG question you will ever face on the Nclex. Let's talk about Rome.
It's so simple, it's brilliant. ROME, respiratory opposite, metabolic equal. Here's what that means. For any respiratory problem, the pH and the PaCO2 arrows go in opposite directions. One goes up, the other goes down. But for metabolic problems, the pH and the HCO3 arrows go in the same direction. They are equal. Seriously, burn this into your memory. It is everything.
Okay, so you have the cheat code. Now, how do you actually use it in a high-pressure situation? Easy. You just plug it into our foolproof 3-step ABG solver. This is the system you'll use every single time. No more guessing.
It's just 3 questions, in this exact order. Step 1, look at the pH. Is it low, making the body acidic, or is it high, making it alkalotic? Step 2, find the source of the problem. Which value, the PaCO2 or the HCO3, actually explains that pH imbalance when you use Rome? And finally, step 3, check for compensation. Is the other system jumping in to save the day?
And that compensation piece is key. If the other system's value is still totally normal, nothing's happening yet. It's uncompensated. If all 3 of your main values are abnormal, the body is trying to fix things, but the pH isn't normal yet. That's partial compensation. But if your pH is back in the normal range, but the CO2 and bicarb are still abnormal, that's your hero moment. The body has fully compensated.
All right, let's put this all into action. It's time to meet the 4 troublemakers, the acid-base villains you'll be squaring off against on the Nclex and, of course, at the bedside.
Here are the main culprits. First, respiratory acidosis. Think low and slow breathing, like in COPD, which traps all that acidic CO2. The opposite is respiratory alkalosis, from breathing way too fast, like with an anxiety attack, and blowing off too much CO2. Then we have metabolic acidosis. This is common in DKA or severe diarrhea where you're losing base. And finally, metabolic alkalosis. The classic cause here is losing acid from vomiting or NG suction.
But here's where it gets really interesting. These villains all have a secret attack, and it involves potassium. Just imagine a seesaw. In acidosis, the body shoves hydrogen ions into cells to hide them. But to do that, it has to kick potassium out. The result? High potassium, or hyperkalemia. And in alkalosis, the exact opposite happens, leading to low potassium or hypokalemia.
Listen up, because this is one of the highest yield facts you need for the Nclex. Seriously, if you see an acid-base question, your brain should immediately start thinking about potassium and the risk for heart problems. Acidosis means hyperkalemia, alkalosis means hypokalemia. Got it? Good.
You've learned the system, you know the villains. Now it's time to prove it. Welcome to the Nclex practice arena. Let's see how you do with some real exam-style questions.
First up,
We've got a pH of 7.28, PaCO2 of 52, and an HCO3 of 24. Let's use the system. Step 1. pH is low, so we have acidosis. Step 2. What's the cause? Well, the PaCO2 is high. Let's use Rome. Low pH, high CO2, they're opposite, so it's respiratory. Step 3. The HCO3 is totally normal. That means the kidneys haven't started helping yet. So our answer is uncompensated respiratory acidosis. Boom.
Okay, next one. pH is 7.50, PaCO2 is 29, HCO3 is 23. Let's go. Step 1, pH is high, so that's alkalosis. Step 2, PaCO2 is low. High pH, low CO2, they're opposites again. It's respiratory. Step 3, our HCO3 is still in the normal range, so no compensation. The answer is uncompensated respiratory alkalosis. You see how this system just works?
All right, time for a tricky one. The pH is 7.38. Wait a minute, that's normal. So right away, you know we're dealing with full compensation. Now here's the trick. Which side of normal is it on? 7.40 is perfect neutral. 7.38 is on the acidic side. So the original problem was acidosis. Now, which value explains that? The HCO3 is low, which causes acidosis. That's our primary problem. So we have metabolic acidosis, and that low PaCO2 shows us the lungs have done their job beautifully. Final answer, fully compensated metabolic acidosis.
You are crushing this. You've officially mastered interpretation. But you know the Nclex, it's going to test you on the practical stuff too. So let's quickly run through the priority steps for actually drawing an ABG.
Okay, before you even think about the needle, you have to do the Allen's test. You've got to confirm good circulation. Then, it's a heparinized syringe, no air bubbles allowed, and you transport it on ice immediately. But what is the absolute #1 highest priority nursing action after you get the sample? It's applying firm pressure to that artery for at least 5 minutes to prevent a hematoma. That's the safety answer the Nclex is looking for.
We have covered so much ground. So here is your rapid-fire, last-minute Nclex cheat sheet. Remember Rome. Always use the 3 steps. Don't forget the potassium rule. Kussmaul breathing is the lungs trying to fix metabolic acidosis. Vomiting is your classic cause of metabolic alkalosis. And a huge one. For your COPD patients, that target oxygen saturation is lower, around 88 to 92%. These are your golden tickets.
Think about it. You started this session maybe feeling that panic at the bedside. And now? Now you have a system, a secret weapon, and the skills to figure it out. You're not guessing anymore. You're analyzing. You are ready for this. So tell me, which of those acid-based villains are you most confident you can take down? You've totally